City of Crawfordsville is located just west of Indianapolis, a little bit north of Indianapolis, about halfway between Indianapolis and Danville, Illinois. We're a community, countywide of about 38,000 people. We face the challenges that many rural type communities face. And, the reality is today the number of healthcare providers, the number of physicians in our community is much smaller than it was, 20 or 30 years ago. And, there are many factors coming at play there, but in the end, we have to find ways to ensure access for all of our citizens while we are growing and we're seeing a reduction in the availability of health care. So primary care has been our biggest challenge by far, and mobile integrated health has helped bridge that gap.
The MIH program came about, fluke conversation. Our past fire chief was reading an article. I'd never heard of it, and he just mentioned that this was going to be the wave of the future and maybe a direction the department should look at.
Hello.
Hi, lady.
Hi, how are you folks?
Good, how are you?
Good. 63 years we've been married. We met at the Ginger Boo in Crawfordsville, Indiana. When I asked her out for a date, she turned me down. Yet I asked her again. And she said, okay.
You coughing anything up?
Not now.
Not now, okay.
It gives us a little confidence in ourselves, knowing that everything's going to be all right.
When's the last time you fell? Can I ask you that?
Oh, it's been a while. Let's see.
Before I was mayor, I was a firefighter paramedic and had been a paramedic for over 2 decades. And shortly after becoming mayor, I was approached by the fire department with this idea of community paramedics. And really the premise there was that we're going to have these additional paramedics who will focus on 911 call reduction.
Mobile integrated health can mean many different things in different communities, but for us in Crawfordsville, we really wanted to start with a small program where we could have a lot of success and see great outcomes.
MIH is an amazing program to help older adults remain in their home. I could name several patients that would have been placed in nursing facilities if it were not for the paramedics going in to support with medication setup. Sometimes bringing in the mail and that chit chat just to keep them engaged and know that somebody cares makes all the difference in someone's life.
It's a case where people are lost in the healthcare system many times. They go home with that list of medications and all those follow-up appointments and dietary changes, and the physician probably had 10 minutes to explain that to them when they were discharged from the hospital.
We really want to make sure that our patients, whether they're in Project Swaddle, our maternal infant health program, or in our chronic disease management program, to live a holistic life and live here in Crawfordsville, stay in their homes, and really focus on that continuum of care, whether it's from when they're babies and starting families or at the end of their life.
I think early on there was a concern about scope of care and everyone staying in their lane. And I think the beauty of what we're doing is it pulls together all those different disciplines within healthcare. And this isn't about eliminating home health care or stepping on anybody else's toes. We've made them part of the solution.
So I don't have an MBA, I'm not a CFO of a healthcare organization, but I know this model of care works, it keeps Hoosiers safe, and it saves money.
This started out as, we'll get a grant and we'll have a community paramedic out there trying to make a difference, and now has evolved into its own city department. How do we ensure stable funding moving forward? Because the grants are great, but they're only, a shot or two, and then you have to try to figure it out on your own. And there's 2 pieces for me. There's the data side and the numbers and the dollars, but there's also the real human side of this. And we get so much positive feedback from the community. This is probably the only city department I've never heard complaints about, right? I mean, everybody loves what they do and it works.
Your legs aren't sore, are they?
No, they're not.
Okay, I don't want to hurt you.
Having organizations such as AARP on board is critically important, because if we're out there telling the story just as the city of Crawfordsville, that only carries so much weight. There's always a distrust when government tells you something is working. So we need those independent partners to help us validate what we're doing here.
This is truly a delivery model that every person should have access to. It's the Hoosier way.
One of the best parts of this job is being able to see the positive outcomes from our patients.
Questions or concerns about anything?
No.
No.
So it's nice to have that security, you know, to say, well, hey, you know, you're doing all right. You're going to make it to the next 2 weeks. So I like that. We're tickled to death where we're at.